Thank you also to Courtney Hawkins, the director of DHS, and to her team. We've heard a lot of information today about child care and things and resources that you can tap into because we know how critical this is. I want to really reiterate what the governor is saying. While we are talking about staying at home, and while it is critical that everyone does, because you understand how the virus spreads, and we need to set up as many conditions as possible that stop the virus from spreading, we need to make sure that we come up with creative ways to still find connection, to still have a community with each other while following these directions and staying at home. So please make sure you pick up the phone and call someone. Let's use the video conferencing as ways to connect with people and support each other through this time. As has been mentioned, we have 18 new cases of COVID-19, which puts us to a total of 124. These numbers continue to evolve every day, and it allows me to highlight some points with what we're hearing with these cases each day. We know that our vulnerable population of seniors and those with underlying illness is where we want to focus having the utmost protection for, making sure that those are the people who definitely are staying inside and not going out, and perhaps has friends or family members who can do the essential only trips to the grocery store or other places for them so they do not have to step outside. I also want to reiterate that with the cases we are seeing, which we have been anticipating and we are evaluating, they are from all ages. We're seeing men and women, adults of all ages. And so it is critical that everyone follows these instructions. We certainly have the focus on our vulnerable population, but we need to make sure our 20-year-olds and our 30-year-olds and our 40-year-olds are also listening, because the virus does not pick and choose who to infect. And if we are going to stop the spread so that we can get this under control and then be able to move towards the next phase that the governor is referring to, everyone has to do their part, young, middle-aged, and older. I want to also emphasize that we are seeing more association with domestic travel than we are with international travel. That's why it is important to follow the quarantining instructions that the governor announced yesterday for anyone who has returned from an airplane trip from another state. They must be quarantined for 14 days or more. We are expanding a robust contact tracing team. We will reiterate that that is the key for us to be able to get to the side that the governor is referring to. First, we need everyone to follow the instructions of staying home, stopping the spread of illness of this virus, certainly making sure if you have symptoms that you are staying home. And as we are identifying people, either by testing, which is still slowly ramping up, but we need people to be patient, or by symptoms. Whether or not you have cold symptoms, consider it COVID-19 and follow the instructions of staying home and recovering safely there, and staying separate from someone else in your home if it's possible. In a separate room, use a separate bathroom, take turns with going to the kitchen. Think of the creative ways to keep that person recovering safely, but away from other people within the household as well. We are expanding a robust contact tracing team so that we can reach out to anyone who has symptoms or a positive test. The treatment is the same regardless, to make sure they have these instructions of how to isolate safely and when to call their healthcare provider if some symptoms are severe enough, and then also to think through who the contacts of that person are, the close contacts, and how to support them in quarantining and staying home for the 14 days as well. Everyone here can play their part. We want to make sure that with this contact tracing and ability to determine person by person who they are and who their contacts have been, these are effective ways that we have to be able to stop the virus from spreading. But we do need everyone to participate. The overall approach is for everyone to be able to stay home. We continue to see that this is an extremely complex and fast-moving pandemic to track. We've started to report by county, and yesterday we shared an age breakdown for the cases. We are working to get more and more numbers out each day. I also want to make one note on overall testing data. As I've been reporting, we have started to partner with hospitals and private laboratories to do testing. One local company, Eastside Clinical Laboratory, has stepped up in a huge way, and we're grateful for their efforts. Along with Eastside Clinical Labs and the other commercial and hospital labs who are doing their best to slowly expand their testing capacity, we are working to get the information needed from them consistently in terms of format and timing so that we can fold it into our regular data updates. Again, this situation and our response are evolving extremely quickly. We are doing our best to get you the information that's needed, and we thank you for working with us, following these instructions and supporting the governor in taking the state where we want to go, because we can get there together. So thank you.